There we go.
Hi, we're going to do a demonstration today on how to put a catheter into a female patient. This demonstration is not intended to be a study aid for your lab testing. For questions pertaining to your lab testing, please consult the critical elements. So, first thing you're going to do is wash your hands, walk into the room, identify yourself to the patient, and explain what you're going to do. Hello, Mrs. Smith. My name is John. I'm one of the nurses here. When I was doing your abdominal assessment, I felt a little bit of distension in there. So we got the bladder scanner, and there was still some urine in your bladder. So I called the doc, and the doc wants us to remove that fluid from your bladder. And the easiest way to do that is to take a catheter and place it into your bladder to drain that fluid out. Have you had one before? Okay, great. At any time during the procedure you're having any pain or discomfort, let me know and I'll stop. All right? So you're going to close the curtains, maintain their privacy, and then you're going to pull the blankets down. If the family members are in the room, it's probably a good idea to ask them to leave while the procedure is going on. Try to keep them as covered up as you can. Spread their legs apart. Try to put them in high followers with their knees raised, which is, what's it called? Dorsal recumbent. Right? So everything that you need to do this procedure is found in the sterile kit here. You will use it in the order that it is in here. So the first thing I do is I open up the container. And place it on the bag. Now this bag here, don't throw it away. This is going to be used for your trash. It really does not matter where you put it. The only place that you should not put it is on the other side of the patient, because when you clean, you're crossing over your sterile field and you're breaking technique. So where I put it is between the patient's arm and their body. That way it gives them, they can hold it for you if they need be. All right. So I'm going to open up my sterile field now. Remember, maintaining sterile technique. Now the first thing you're going to find in here is an absorbent pad. You can put on a pair of clean gloves while you put it in there, or you can just grab a corner. So I just grab a corner. Shiny side goes down. And then I place it between the patient's legs. And then hopefully that they're able to lift their hips for you so you can roll it in, so you can get underneath there. All right. Next thing in here is your sterile gloves. So you're going to take your sterile gloves and you're going to put them on the appropriate way. Now what I do is throw it in the trash and then put your gloves on. Once they're on, you can fiddle with them to get them the way you like them. Alright. Next thing in here is a pad that goes over the orifice. It is optional. You can use it if you want. You don't have to. But we'll use it. So we're going to put it right over the opening. Then what I'm going to do is I'm going to grab the whole container and I'm going to bring it and I'm going to put it between the patient's legs. And I'm going to separate them. Okay. Now in the kit is some lubricant. Betadine swabs, and a syringe so you can inflate the balloon. So the first thing I'm going to do is I'm going to check to make sure the balloon works, because if it doesn't, then I have to get a whole new kit. So I'm going to attach it to the port here, and at the same time I'm going to remove this plastic wrapping, making sure I don't break sterile technique. Now I'm going to inflate the balloon. Can you see that there? The balloon is inflating and it works well. Once I let go, the water does come back into the syringe. I'm going to put the whole thing back into the box here, because it's sterile there. Now, I'm going to take my absorbent pad, or my, excuse me, take my lubricant, open it up, and put it right into my package. Get rid of it. And then I'm going to take my betadine pads, and now I'm going to open them up and I'm going to take all three of them out. And the reason for that is if you leave them in the package, once this hand goes on the patient, it is now dirty. You can't go back into the sterile field, and it's really hard to get them out. So while both hands are sterile, I'm going to take them out, and I'm going to put them into my sterile field. Okay, so now what I'm going to do is I need to clean. So I'm going to take my dirty hand and I'm going to open up the labias. And I'm going to take the first one and I'm going to clean one side and throw it out. Clean the other side and throw it out. And then clean right down the middle and throw it out. Take your Foley, lubricate it up, and then I'm going to insert it until I see urine. 2 inches or until I see urine. Okay, Mrs. Smith, take a deep breath. Insert it. And then once I see urine, I'm going to stop, and then I'm going to inflate my balloon. Okay, once the balloon's inflated, then you can disconnect, and then give a gentle tug to make sure that you're in the right spot. At this point, you should see urine start to flow in here. Okay, now what I'm going to do is I'm going to take off my gloves, wash my hands, and put on a pair of clean gloves. And then I'm going to attach the Foley bag to the bed frame, not the bed rail. The reason that we change the gloves is because your hands are going to be contaminated with betadine and stuff like that. You don't want to get on the Foley bag because betadine is a great medium for bacteria to grow. So we'll take our bag, Foley bag, and we will hook it to the bed frame. Now they make commercial leg straps that you can use. You can use tape. I wouldn't want tape, but you could use tape. But the commercial leg straps work well. Then we're going to clean up our mess. And then we're going to recover the patient back up. Okay, does that feel okay, Mrs. Smith? I know it feels a little weird. And that is a demonstration on how to do a Foley. Thank you very much.